Hello, everyone. I welcome you all to the first episode of our podcast, Health OK Please. I am Anika Chabra, a member of NSS BITS Pilani and your host for today. In this episode, we will be talking about the arch nemesis of our healthy world, cancer. Thankfully, while awareness about cancer has been increasing over the years, one form that often gets overlooked is cervical cancer. Today, I have with me our guest speaker, Mrs. Mridu Gupta, who has over 2 decades of multifaceted experience and a long track record of successful management in the social sector. She is the CEO of CAPED, which is a trust that has been working endlessly towards the dissemination of information and creating awareness regarding cancer. Welcome, ma'am.
Thank you, Anika. Thank you. And thank you to all the students of NSS BITS Pilani for having me here. I agree with this introduction of yours that when everyone's talking about cancer, cervical cancer gets left behind. So thank you for having me.
Welcome, ma'am. Thank you, ma'am. You have been doing wonderful work, and we also really look forward to this being an enlightening session. So, starting off with the basics, ma'am, can you tell our audience briefly about cervical cancer and its cause?
Yes. Since that's the area we work in, definitely I would love to talk about cervical cancer. So we are CAPID, which is Cancer Awareness, Prevention and Early Detection. And we work largely for cervical cancer because it is one of the only cancers which is 100% preventable. You can completely prevent cervical cancer. And yet in India, we lose one woman every 8 minutes to cervical cancer. Can you imagine the waste of life? Something that can be completely prevented, which has been eliminated in a number of countries down. I mean, death by cervical cancer has been, and yet in India, we lose one woman every 8 minutes, which is the reason why we're talking about cervical cancer. Cervical cancer is caused by HPV, which is a virus, the HPV virus. These days, everyone's talking about coronavirus, the COVID. The virus has become so much in the news. HPV is a virus. It causes cervical cancer. There are two vaccines for it, and yet we don't talk about it. It is just as bad as any other viral infection because there is no treatment for a virus infection. All you can do is prevent it. You have vaccinations to prevent a viral infection, but there's nothing you can treat a viral infection with. So we work in the prevention of cervical cancer largely because India carries 1/4 of the world's burden of cervical cancer. It is a 100% preventable disease, and it is easily prevented by vaccination and by screening that we will discuss. These are three factors by which we can actually eliminate cervical cancer, and we don't need to lose so many women to it. Therefore, I think cervical cancer conversation is very important.
So, ma'am, what are its complications?
So, you're talking about complications, which would mean that you're talking about cancer. Cervical
Yes.
cancer is the same as any other cancer. It could have chemo and radiation or surgery or whatever. But the fact is that once you get an HPV infection, once the woman has an HPV infection, it has a very long period to become cancer. HPV infection can be caught long before it becomes cancer. So the actual complication is that the women in India don't go in for regular health checkups. They don't go in for a gynae checkup. So if they do have an infection, it doesn't get caught till the time it becomes a cancer. Once it becomes cancer and it is the second or the third stage, they get to the doctor because then they have symptoms of cancer. So if you speak to a doctor, they will tell you that one of the largest problems we have with cervical cancer is the women come in very late. They pass it off as gynae problems, they pass it off as regular, menstrual problems. They do not recognize it as something abnormal. They don't catch it in the precancerous stage, they don't catch it in the early cancer stages. By the time they get to a doctor, it's too late. That is a large complication. Otherwise, cervical cancer is preventable, which means that we can catch it even before it becomes cancer.
Okay. So, what significance does one's lifestyle have in acquiring the disease?
So I'd like to compare it now with this very common knowledge of COVID. We all talk about raise your immunity, be healthier, right? Even HPV is the same thing. If the woman has a good immunity, she will wash off the HPV infection on her own. right? It does not need to convert to cancer. So a lot of women who are healthy, who have good nutrition, who are exercising, who have good immunity, they wash off this on their own. So a large number of women will get HPV infection, but most of them will wash it off because of their high immunity and their hygiene and their nutrition and the rest of it. The ones who cannot wash it off, it stays with them for a long period of time and eventually converts to cancer. So definitely your lifestyle, raising your immunity, doing all the things you would do for any other viral infection are really important for cervical cancer too.
Okay, so so let's come to the diagnosis. So what are the signs and symptoms of cervical cancer?
Okay, so before we get to that area, I have to tell you that cervical cancer is a sexually transmitted infection. Okay, it's an HPV. You heard about HIV, right?
Yes,
That's
yes.
AIDS. This is HPV. It is a
Okay.
sexually transmitted infection, and it is not the disease. The disease comes if you haven't washed off the infection, but the infection is sexually transmitted. Okay? So one of the, even earlier, one of the lifestyle changes would be being aware of your sexual partner, using prevention, using precautions for sex and things like that. So one of the symptoms of cervical cancer is also uncomfortable intercourse, bleeding in between or immediately after sex. A lot of things related to your sexual health could be symptoms of cervical cancer if you were aware of it. And then, of course, is abnormal bleeding any time of the month. You have weight loss. You would have irritation. If it was advanced, you'd have pain. You would have other kinds of symptoms. The problem is that the symptoms are very normal. These are not really symptoms of anything in particular. You could pass them off as just some kind of, periods are bad, or maybe I'm just not feeling well, maybe I'm feeling weak. They're not very specific symptoms of anything. Therefore, you need to get them checked. White discharge that is foul smelling is the most common. So if you have exceptional white discharge, excessive in amount and excessive in smell, then it definitely needs to be checked. Whether it is HPV or it is any other infection, there is something that needs to be checked. Abnormal bleeding needs to be checked. Problem with your sexual health needs to be checked. These are prime areas for an early diagnosis.
Okay. So can cervical cancer be diagnosed early, and if so, then how?
So cervical cancer, we can diagnose it even before it becomes cancer. So we diagnose it in the pre-cancerous stage is what we call it. So if you go for a checkup, there is a screening. Screening is done, and they say it needs to be done 3 years after your sexual debut. The recent guidelines are that it needs to start for women over the age of 30. They assume that till 30, a woman will have enough immunity to wash it off. If she still has the infection after 30, they will take action. So let's say that your screening starts after the age of 30. There's a very simple pap test that is done in the hospital. It's a 10-minute test. When we go to do screening in the field, we start at 10 o'clock till 5 o'clock. We do about 120 tests for the rural women. It's that quick. It doesn't take any time. So it's about 10 minutes. You can get a pap test done. These days, there's a more specific test called the DNA, HPV DNA test. It's a DNA mapping. So you can get a pap and an HPV DNA done. And that you have to get done once in 5 years. And the pap test alone, you get done once in 3 years. And if you get this test done, it will catch the HPV infection early. You needn't ever have cancer. Just go for your checkup. If you're a sexually active woman, you're over 30, go for a pap test, go get your HPV DNA test done. If there is anything early, precancerous, they will catch it. You can have it cleaned up. There is no need to get cancer. So I'm talking about preventing cervical cancer. I'm not even talking about catching cancer early. I'm not saying first stage cancer. I'm saying pre-cancer, we can catch it. It's that simple.
So, what is the treatment available for it?
So if you're talking about diagnosis of cancer,
Yeah.
then once you have cancer, they will give you the cancer treatments will depend upon the stage you are found in and what needs to be done. It's the same chemo, radiation, surgery, and the rest of it. If you are going in for regular checkups and you are going in for your PAP and your HPV and they find an infection or they find lesions that are early, they can treat it in an OPD process. There is an OPD process. You go in, they will remove the infection. They have a couple of different processes wherein they can clean out the infection and you are treated for it. If you go in at a cancer stage, then it will be treated as a cancer. Then they will do whatever is required for that stage and that process of cancer.
Okay, so what steps should be taken to prevent oneself from cervical cancer?
Very, very important. Okay, because that is why I gave you our name in the beginning. We believe in awareness and prevention. You have to prevent. And I have to tell you, most cancers can be prevented if caught early. If you catch them early, they can be prevented or they can be treated. There are some cancers that can be prevented. There are some that can be treated if caught early. So the fact is that you've got to be aware of your health. And I love the name of your program. What was the Health Okay Please?
Yes,
Yes.
health. Okay,
Health Okay Please is just the right name. Please be okay about your health. Go and get it checked. Very important. So you were asking me what are the preventive measures, right?
yeah. What steps should be taken to prevent oneself from cervical cancer?
So in girls in India, we're talking about girls from the age of 9 to 14 have 2 doses of a vaccination that can be taken. Girls from the age of 14 to 26 in India, they have 3 doses of a vaccine that can be taken. Over the age of 30, you go in for a screening, which is a PAP or an HPV DNA test. This is what can be done to prevent. Now, the vaccinations, we have 2 vaccinations in the country. One is by Merck, one is by Glaxo. For the younger girls between 9 to 14, they have to take 2 doses of the vaccination, one today, one 6 months from today. Okay, it's exactly like you would take your COVID vaccination. You take 2 doses, you take one after whatever, 2 months, 3 months, whatever is the new directive coming in. And for in India, we do it till 26, but abroad, in the developed countries, they do the screening only till the age of 21. From 14 to 26, you get the vaccination. You have to take 3 doses of the vaccination. One is today, one is 2 months from today, and one is 6 months from today. Right? So within 6 months, you have to finish your vaccination dose, and all girls should take it. Having taken the vaccination, you still need to get screening done in your life because the vaccination prevents you from 70% it has 70% efficacy. So there's still 30% chance that it might come back to you. Same, as we're talking about today. Therefore, you will still need to get screening done, but at least you have the peace of mind that it will not be a strong infection. It is preventable. All of that is taken care of. So you need to get the vaccination done and you need to get your screening done. These are 2 stages of prevention of cervical cancer.
Okay, so are there any long-term effects of the vaccine?
So the vaccine has been in the field now for about 16 years. Okay, it came to India in 2008, 2009, I think. And it has been out, it's been there in the public, in mass use since 2004, 2005. So in these 16 years, there have been no effect. Long-term effect would mean some adverse effect, right? There has been
Yes,
no
yes.
adverse effect to the vaccine so far. Of course, there is an anti-vaccine lobby which is there for everything, including the COVID vaccine now. So there is a whole anti-vaccine lobby, but we haven't seen any adverse effect to the cervical cancer vaccine, to the HPV vaccine. So it's not called a cervical cancer vaccine, it's called the HPV vaccine. It prevents from the HPV infection. And in the developed countries, the vaccine is given to all children, boys and girls. In India, we are trying to make women aware of taking the vaccine. We are still there. We're just trying to get girls to take the vaccine. But in all developed countries, it's given to all boys and girls.
And what about the short-term side effects of the vaccine?
So unless you, of course, have some kind of an allergy, or if you've had any adverse effect to any other kind of a vaccine, or you have something in you that is susceptible, then you need to tell the doctor, and then they'll decide whether it's a protein, whether you have some kind of a particular food allergy or whatever. But otherwise, the vaccine has got no side effects, not even short-term side effects. It's
Okay.
nothing. It's just a general vaccine, and we give it at the age of 9 to 14. That's the age when children get all their vaccinations, right? You get your smallpox, you get your booster doses, you get everything at that time. At that time, you take this vaccine also.
So, as in the case of most health issues, the space around cervical cancer is also filled with a lot of confusion. So, we have picked some perceptions that exist widely in our society and would like you to clarify those to our audience as myths or facts.
Okay.
So, the first one is vaccine affects the menstrual cycle in females.
Vaccine.
Yeah.
No, vaccine doesn't do any such thing. Where do you get these? I mean, is this something that if you wanted to look for the vaccine, it would come up on the net or something on its own? A myth like that?
Yes, yes.
Is that?
It, I mean, I think it's a common perception, right? Because it's related to the reproductive system, right? So I think that's why it comes up.
True, but actually, it attacks the body as a virus. It's an antivirus that is in the body. It is not necessarily only for the reproductive system. It's just so when men take the HPV vaccine, it is not going into their reproductive system. For men, their mouth, oral, penile, anal cancers are also caused by HPV vaccine. So it by HPV, sorry, by the virus. So even they take the HPV vaccine, it's not affecting their reproductive system. It's for oral and mouth. It's an antiviral vaccination. So it has nothing to do with your reproductive system per se. It doesn't do anything to the menstrual cycle.
And the second one is cervical cancer only affects elderly women.
Okay, so this is something that I have also come across multiple times. What happens in women is that once you hit menopause, after menopause, your immunity level starts to fall down, right? while you are while there is menopause and while you have your regular cycles and everything, the body is far healthier. When after menopause, the woman's immunity naturally starts to reduce. So if she did have the infection and the immunity had kept it in check, the minute your immunity begins to fall, the infection begins to manifest, and you will begin to, maybe in 10 years from the time your immunity has fallen, you might show cervical cancer signs. So it seems like that is a peak. Yes, 60, 62 is a peak. Even 40 is a peak. 40-year-old women also see cervical cancer. At 60 also we see cervical cancer. So it's not like elderly women get it. But yes, because of a drop in immunity, if they already had the infection, it would have manifested maybe around 60 or a little over 60. So that's the reason that these women, we see the peak in cervical cancer. It's not otherwise, it's not like elderly women get the infection more. No, it's a progression of the disease after your immunity starts to fall.
Okay. So, and the third fact or myth is cervical cancer is inherited genetically.
So, like I told you, it's a virus. There are a lot of cancers. You have to keep an eye on your history, right? If cancer is in the family, the tendency of your body to respond to carcinogens is a particular kind. So, the chances of you getting any kind of cancer is more. Therefore, there is always this point of keeping an eye on your family history. Yes. But per se, cervical cancer is caused by a virus, right? So the virus does not come down your genes. Virus is gotten from the environment. So it is not as such, but we say 99.9% cervical cancer is caused by the HPV infection. Right? So there is always that 0.1 chance that it has come in from somewhere else. And to be aware of cancer in the family, to put it down in every medical document you have that you have cancer in the family is important. So we are not negating the fact that you need to be aware of the cancer history in your family, but cervical cancer per se is a viral infection and not caused by any genetic factor.
All right. Um, Moving on to the fourth, HPV virus spreads through sexual contact.
So HPV virus spreads through sexual contact. Yes, it is the largest sexually transmitted infection. Therefore, we always say that when we go to schools and colleges and we give our talks, don't just have the women come in, have the men come in. Because the men are equally important to the eradication of cervical cancer, right? They are the carriers. They also get the HPV infection. It does not cause any fatal cancer for them in large numbers. Like we say, 99% cervical cancer is because of HPV, and largest number of women we lose due to cervical cancer. Therefore, it becomes very important for the woman to be aware of it. But the men also get HPV infections. They have oral cancer, they have mouth cancer, they have penile cancer, they have anal cancer, they have multiple cancers, and the virus spreads through touch. It is like the HIV virus, we say it moves through body fluids and things like that. The HPV virus is through touch. So it is a skin contact that transmits the virus, and it reaches your cervix due to it's as a sexual infection, right? There is no other way for it to be. So it is a sexually transmitted infection, not the disease. The disease is not, cancer is not being transmitted sexually. Only the infection will go. So yes, largely it is, and which is the reason why one of the factors for preventing it is to be aware of your sexual history, to have protected sex and things like that, which is something that, you know, in our country, I can take 5 minutes. In our country, HIV, we started talking about it much later in the day because, you know, it's taboo to talk about sexual diseases. How do we say it in a way that doesn't offend people? Blah, 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 blah. By the time we actually got to talking about it, the whole world had done a lot about it. HPV is very similar. We don't talk about it. We are not comfortable talking about it, which is why as an organization, we go to the youth. Largely, we go to schools and colleges because it is the youngsters who don't have a problem talking about it. I don't expect women my age or your mothers to be talking about sexually transmitted infections, but the youth don't have a problem discussing it, right? So therefore, we go to the youth to talk about this. And yes, we would really want conversation around it because there's no way that we are going to eliminate cervical cancer till we don't start talking about it.
So the next one is males aren't affected by the HPV virus.
Okay, I think I've made a lot of noise about this through this talk already. Yes, men do get HPV infection and it manifests as cancer in multiple areas of the body. They are also carriers of it for cervical cancer in women. So men definitely need to be more aware of their role with HPV. And if you were to travel out of the country to study or whatever, you would be asked to take the HPV vaccine, whether you were a boy or a girl. All children would be asked to take the HPV vaccine. It's only in India that we don't do it. So yes, men are as much.
So, ma'am, how will men get the vaccine since it's not available for men in India, right? So, for example, if a man wants to travel abroad, then how will he get the vaccine?
No. If you're going to study, they are going to ask you to take the vaccine because it's a list of vaccines for you to come. Usme HPV vaccine bhi hoga. So if you're traveling, nobody takes the vaccine. That's just malaria or whatever is a normal thing that they ask you to take when you fill up your visa form or something. So if he needs to take the vaccine, if it is mandatory and you go like my son, when we went to the doctor and said that these are the vaccines he has to take, he was given the vaccine. And there are some pediatricians in India who are doing the vaccine for boys and girls. We've met 2 such people in Delhi. We even interviewed them. I think it must be up on our YouTube somewhere. We asked them why they do it, and they said that because it is supposed to be for boys and girls, and I do it. I inform all the parents of boys that they should take the vaccine. Some do, some don't. So there are some pediatricians who are okay to give the vaccine, but largely, as a rule in our country, girls get the HPV vaccine. It's available for girls.
So legally, like boys are not allowed to get it.
Legally, there's nobody stopping you legally from taking it. But as a mandate for doctors, if you have a list of vaccinations. So for pediatricians, it specifies HPV vaccine for girls. So if you want to be on the right side of the directives that come from medical profession, they will say it is for girls, and it is for girls. But the world over, it is for boys and for girls.
All right. Okay. So, ma'am, can you also talk about some other prevalent perceptions and experiences regarding cervical cancer or anything you've come across?
So, let me just give you a little overview of cervical cancer in the world and in our country. On the 17th of November last year, 2020, WHO had come up with this elimination strategy, global elimination strategy of cervical cancer. and they have a whole chart on how countries are doing and how they are going to eliminate. So they claim that Australia will have eliminated cervical cancer by 25, and by definitely by the 2030 SDG goals, they would have done it. Okay? India, they say, even 2130, we would not have achieved elimination of cervical cancer. So to say we are 100 years behind is also an understatement. Okay? That is how we are with cervical cancer. You are talking about cervical cancer. I am very, very impressed. Right? We have to actually introduce the topic wherever we go. People are not talking about cervical cancer. So one of the first things to do about cervical cancer, of course, we are looking at national policies, looking at national forums, but also as individuals, we have to create awareness of cervical cancer. So definitely, everywhere we go, when we ask a group of people if they've heard about cervical cancer, you will get very few people who will raise their hands. You've heard about cervical cancer. Have you done anything about cervical cancer? Nobody, right? They would have had a pap test if the doctor had said it for some other reason. You've gone to the doctor for some reason and the doctor has suggested an HPV DNA test for you. You've gotten it done. That's the only reason women have done it. They haven't consciously gone there and said, I need to get a HPV test done. Okay? Very few people. Parents have given their children vaccine because a pediatrician has suggested it and they trust their doctor and they've given the vaccine. Nobody has gone and asked for it as yet. So that area, we need to create a lot of awareness. And to create awareness, if you can see our logo, the color on our logo, in fact, the color of the wall behind you is exactly our logo. It's pink and this other color. Now, this other color that is on our logo is called teal color. Okay?
Yeah.
It's TEAL. It's teal color. January is the month of cervical cancer awareness. And this is our color. Just like pink is the color for breast cancer, teal is the color for cervical cancer. So I want to tell all the youth out there, every time you see this teal color, think about cervical cancer. Okay? And every time you think about cervical cancer, please talk about cervical cancer. Please make sure that you tell the women around you to go and get a pap test done, a cervical cancer screening done, if nothing else. So just make it a thumb rule that every time you see the teal color, चाहे वो दुपट्टा हो, चाहे कपड़ा हो, चाहे दीवार हो, चाहे कहीं भी teal color दिखे, stop, think about cervical cancer, and make sure you tell at least 10 people around you about cervical cancer. That's the only way we're going to start conversation. So unabashedly, let's talk about cervical cancer. बुरा बोलने से बुरा हो जाता है. Everyone is so scared to even talk about cancer. You shouldn't talk about bad things. You know, वो बुरा ही हो जाएगा. So we just don't talk about cancer. That's something that we found all the time. Another thing we've seen even in the villages that we go to, when we do a screening. So as an organization, we create awareness like we're doing with you, and these days more virtually than otherwise. But in rural India, we work with the villages and the bastis and things like that. Even now we are working with the Haryana government. We're going village to village. We create awareness and we also do screening. So we do a pap test in our van. We have a medical van, we do. When we do a pap and we get an abnormal report, that means the woman has to now go for further diagnosis before we can say what it is. The minute that happens, the whole family just has this block कि हमको पता नहीं करना क्या है. We don't want to be treated क्योंकि अगर cancer है तो it is very expensive. That means that she's going to die anyway. So these kind of perceptions about cancer, this fear about even not wanting to find out कि क्या है, जो है ठीक है, because it will just be more, it will be painful, the treatment is very expensive, anyway you're going to die. These are choices they have to make. So nobody wants to know, which is a big barrier for us. It's like a stone wall that comes up and we can't get past that. There are very few women or families of the women who are willing to get the further treatment done. So this counseling of families for cancer, that cancer can be treated, it can be prevented, it needs to be looked at without fear, is something that needs to come into normal, into our healthcare system. And in India, women don't get up and go and get treated. Like I was telling you, from infection to cancer, it is almost a 10-year period. You know that it takes 10 years. It takes from 1 to 10 years for an infection to convert to cancer. And yet, we have one woman every 8 minutes who dies of cancer, which means that women don't even go to the gynae. So if she's not feeling well, she'll eat one dawai. Garam pani ki bottle rakh loge, dawai kha loge, painkiller, just get through it and then you're okay again. You know? You'll keep following it. If her husband sneezes or her kid sneezes, she'll go running to the doctor. But she will not go for herself. So women health is very, very important a factor for us to look at in the country. When she has her children, she goes to see the gynae. And then menopause में कोई problem होगी तो she will see the gynae. वो बीच में she will not see the gynae even once because there's no problem. I'm perfectly well. ये regular checkup वाला concept जो है, that is something that we find missing among urban and rural women. चलो rural women will not give up one whole day and go and get checkup done. But urban women, nobody in India goes for a regular checkup unless it is company mandated. जैसे you're working for a company and you have a health insurance and you have to go for a checkup, they go. उसमें भी कई बार PAP नहीं होता है. But women, to be in control of your health, to be able to do these kind of tests that are going to keep you fit and fine till you are old, is a very important area that we must address in our country and in our homes. So when did your mom last have her checkup?
My mom went for a checkup like 6 months ago. She got a pap test done.
Oh, wonderful.
Yes, she gets the
She
routine
gets it
checks
done
done.
regularly.
She goes to the gynecologist regularly.
So that negates my
And I got the vaccine.
Very good. So
Yeah.
very, very aware. Thank you. And how did you hear about this whole thing, if I can ask?
So basically, my pediatrician, like who gave me all my vaccines, she recommended that I should get the vaccine. So I was, I think, 16 at the time. So I got three doses, and my younger sister, she was 12 at the time. She got only 2 doses.
Perfect. So you know this whole stuff that I have just spent half an hour talking about. Correct. So you have also been recommended by the pediatrician, which is what in India we will need to do because people are not aware of it. So it has to come from the doctors, this whole conversation. But we should also start making people aware so that they can go and ask for it also. Right? Women should go and ask for the vaccine or ask for your daughter to get the vaccine or however. Very important that we do that. So, and women need to take care of that. Even if we say vaccine, अपनी बेटियों को तो लगवा देंगे, खुद नहीं कराया होगा. So that discord we need to clear out for women. Women need to be responsible for their own health. These are the areas that are challenges for us when we are out there. So I just want to put it out for everybody.
Ma'am, one thing I felt is that the vaccine is a little expensive, right? For the rural people, rural women to get it. So do you think the government should provide it for free, like it's doing with the COVID vaccine?
Kitna lobbying हुआ है उसको. Everybody has said put it into the immunization program, do it.
Yes.
But abhi tak they have, even the last time it went for the national health policy, the government said that we are focusing our funds on TB and polio. They need to be eradicated because we worked a lot on them. Abhi not the HPV, but just to tell everybody that these vaccines are from Merck and Glaxo. And yes, they are expensive. When we go into rural India, we don't even talk about the vaccine because we know that you cannot afford $6,000 worth of the vaccine and then the doctor and whatever. But now there is an Indian vaccine that will be coming out. It was to come out in 21. I don't know, because of COVID, it just may be delayed and we might expect it next year. But somewhere there has been a lot of discussion about it. We know that it is in manufacture. When it's going to come into the market, I don't know. But when it does come into the market, a lot of organizations are already waiting and ready that when it comes in, we will start to move it in rural India. Having said that, there are states like Delhi and Sikkim who have made the vaccine part of their state program. So in Sikkim, you get the vaccine free at certain points. In Delhi, at their district hospitals, the vaccine is supposed to be available. I don't know anyone who has availed of it, but definitely the conversation has started for state governments also about the vaccine.
Yes, in Delhi, like I remember there was a workshop in my school. So yeah, the vaccine was for free, but only for people who have a residential address of Delhi.
There were a lot of catches in that. Also, in India, we have no method of, now with COVID we do, but otherwise we had no method of monitoring. So if someone takes one vaccine and goes away, whether that person came back to take the second vaccine or not, nobody is keeping data. Now with COVID, we've started to keep data. And in other countries, in the developed countries, they have a central data. So they will remind you that your vaccination is due. So they know that everyone has taken their 2 doses. In Delhi, even the ones that have gone, people don't know whether they've taken both their doses or not. Only the person who's taken it knows that I've taken 2 doses. So there is a logistic issue in India to do it. But having said that, there are states that have worked on the vaccine and have managed to do a very good job. Rotary is doing a lot about vaccine. They're going to schools, government schools, and vaccinating the girls in the schools. So you know how many girls there are, you know how many you vaccinated. You can go back in 3 months and vaccinate them again. So it's a better process. So there has been work, but definitely when the vaccine becomes cheaper, it will be a lot more uh, prevalent in the country.
Yeah, totally. Okay. Thanks a lot, ma'am, for joining us today
Thank you.
and and spreading awareness and helping us spread awareness about cervical cancer.
Absolutely. I'm very happy to have had the chance to speak to you, and I hope I have been emphatic enough that this will stay in the minds of people who hear and they will be able to talk about it and they will know what needs to be done. First, your family, then the people you know around you, and finally, everybody you meet. That is how we are going to spread awareness on.